Hi all, welcome to Physio Exam Buddy. This video is on the platelets. This was a recently asked university exam clinical scenario long essay question. A 40-year-old woman was presented with fever and reddish purple spots on her skin for the past 2 weeks. Please keep in mind this duration, that is past 2 weeks, and her platelet count was 40,000 per millimeter cube of blood. Name the most probable condition. So, what is your diagnosis here? It is a 40-year-old woman and presented with fever and reddish purple spots on her skin for the past 2 weeks. So, this may be the clinical picture of the patient. So, what is the most probable condition? It is idiopathic thrombocytopenic purpura. Here, the clues are platelet count is 40,000 per millimeter cube. You know that the normal platelet count ranges from 1.5 to 4 lakhs per millimeter cube. So here the platelet count is small. And the second clue is reddish purple spots. It is petechia or purpura due to small vessel bleeding. And there is fever which may be associated with a preceding viral illness or any secondary cause. And also the duration here is 2 weeks, suggesting a subacute onset rather than an acute onset. Okay, so the most probable condition here it is idiopathic thrombocytopenic purpura. For some, there may be a confusion that they may ask that whether the diagnosis can be dengue fever. It's a good question, but dengue causes fever, low platelets, and sometimes reddish spot. But here it is more likely idiopathic thrombocytopenic purpura because of the duration of the illness. Dengue is usually of acute onset, that is, it lasts only for 5 to 7 days. But here the fever as well as reddish spot was there for the past 2 weeks. Okay, so this patient had symptoms for 2 weeks, so which is unusually long for the uncomplicated dengue. And again, the dengue usually presents with high fever, severe headache, myalgia, and sometimes bleeding. Here, the presentation mentions only the fever as well as purpura. So, most probably the diagnosis is the idiopathic thrombocytopenic purpura. Now, other sub-questions are what are platelets? Add a note on the structure and function of the platelets and comment on the bleeding time and clotting time expected in this patient. So, we will see each question, the answers of each question one by one. So, first question is what are platelets? They are basically small formed elements, smallest of the formed elements, and they are minute disc shape having a diameter of 2 to 4 micrometers, and they are actually granulated body and they lack nuclei, and the normal count is 1.5 to 4 lakhs per microliters. Next question is about the structure of the platelets. This is the structure of the platelets. It has a double layer of cell membrane. That is, it is formed of an outer glycoprotein layer as well as an inner lipoprotein layer. And the importance of this outer glycoprotein layer is that it prevents the adherence to the normal endothelium, whereas it causes adherence to the injured areas of the vessel wall because of the subendothelial collagen exposure. And next to the glycoprotein layer is the lipoprotein layer, and it is formed of the phospholipids, glycolipids as well as cholesterol. And this phospholipid contains a platelet factor 3 which helps in the clotting. And you can see here that the cell membrane, it is extensively invaginated with an intricate canalicular system which is in contact with our extracellular fluid. And this cell membrane has receptors for many substances. The receptors include collagen receptors are there, receptors for ADP, von Willebrand factor, fibrinogen, thrombopoietin as well as prothrombin is there. And they are the precursors for thromboxane 8-2, prostaglandin, platelet factor 3 and 4 as well as leukotrienes. This is the diagram you are supposed to draw along with the structure of the platelets showing the outer glycoprotein, inner lipoprotein layer, inside the cell membrane layer there is a layer of the microtubules surrounding the whole of the cytoplasm, and we will see in detail the contents of the platelets in the coming slides. So cytoplasm, you can see here that the microtubules, they forms a ring around the periphery, and many contractile proteins like actin, myosin as well as thrombasinin was present inside the platelets, and it also contains the endoplasmic reticulum as well as Golgi apparatus, which will synthesize various enzymes, and it is the storehouse for calcium. And it also got mitochondria, which releases ATP as well as ADP, and many enzyme systems like prostaglandins. Fibrin stabilizing factor as well as growth factors form other contents inside the cytoplasm. Then glycogen, lysosomes as well as two types of granules were also present inside the platelets, and these granules are dense bodies as well as alpha granules. We will see a bit in detail about the two types of granules, that is the alpha granules as well as the dense bodies. The contents of the alpha granules are clotting factors, particularly factor 5 as well as fibrinogen, and thrombospondin, platelet factor 4, beta thromboglobulin, and the platelet derived growth factor, that is PDGF. They forms the contents of the alpha granules. This can also be asked as an MCQ question. And this platelet derived growth factor, it is the one which stimulates the wound healing as well as it is a potent mitogen for the vascular smooth muscle growth. Next, about the dense bodies. What are the contents of the dense bodies? They mainly contain non-protein substances like serotonin, ADP, ATP as well as calcium. What do you mean by thrombocytosis? Whenever there is an increase in the count of the platelets, it is known as thrombocytosis. That you will usually get in case of polycythemia vera after surgery as well as after splenectomy. Here, the clinical scenario is thrombocytopenia, that is decrease in the platelet count. The conditions in which you get thrombocytopenia are idiopathic thrombocytopenic purpura, aplastic anemia, hypersplenism, and hemorrhagic fevers like dengue and leptospirosis. And also you can get thrombocytopenia after radiation therapy as well as chemotherapy. Although this question was not asked in this clinical scenario, these properties of platelets can be asked as a 6-mark question or short essay question. So the properties of platelets are also included in this video. What are the properties of platelets? The main properties, the 3 main properties are adhesion, activation and secretion, and aggregation. So first property is the adhesion. What do you mean by adhesion? It is just the binding of the platelets to the non-platelet surface. That is, if the platelet binds to the subendothelial collagen of the vessel wall, it is known as adhesion. And the second property is the activation and secretion. That is, if adhesion happens due to some injury, then the next step will be activation as well as secretion, followed by the third property or the third step, that is the aggregation. Aggregation means binding of the platelets with one another, that is grouping of the platelets. First property of the platelets, that is platelet adhesion. Adhesion means attachment of the platelet to a non-platelet surface. Normally, our platelets don't adhere to the normal endothelium, but if by some reasons the vascular endothelium is damaged, then the platelets will adhere to the exposed subendothelial collagen. But this adherence occurs directly only in case of large blood vessels. If the blood vessels is small, in between the platelets as well as the collagen, they require another factor which is known as the von Willebrand factor. So platelets will attach to the von Willebrand factor and the von Willebrand factor will attach to the collagen in case of small blood vessels. But in case of large blood vessels, it occurs direct adhesion between the platelets with the subendothelial collagen. So that is the first property of the platelets, that is platelet adhesion. So first, in case of small blood vessels, this von Willebrand factor, you can see here that the von Willebrand factor, this red one is the von Willebrand factor. They will bind to a receptor on the subendothelial matrix, and this von Willebrand factor will also bind to a receptor which is present on the platelet membrane, and the receptor to which the von Willebrand factor binds on the platelet, it is known as GP1B or glycoprotein 1B receptor, which is present on the platelet membrane. So on the platelet membrane, there is a receptor that is GP1B or glycoprotein 1B, which will attach to the von Willebrand factor, and this von Willebrand factor link the platelet to the subendothelial matrix. But in case of large blood vessels, the platelet can directly bind to the collagen in the absence of von Willebrand factor itself. And the receptors on the platelet membrane, they are glycoprotein 1B, and they belong to the integrine membrane proteins belonging to the class of integrins. Whereas the ligand can be either von Willebrand factor in case of small blood vessels, and the von Willebrand factor, the release of the von Willebrand factor is with the help of the high shear stress or cytokines or hypoxia. All these three can trigger the release of the von Willebrand factor in case of small blood vessels. Whereas the platelets directly get attached with the GP1B and the collagen in case of large blood vessels, that is either with the collagen, fibronectin or laminin, which are the components of the subendothelial collagen matrix of the endothelial tissue. Next step is the activation and secretion. Once this platelet binds with its receptor GP1B to the subendothelial collagen, this triggers the conformational change in another platelet receptor, which is GP2B3A. It is again located on the surface of the platelets, and the binding of the ligand triggers an intracellular signaling cascade, which leads to the platelet activation. And this signal transduction cascade involves activation of phospholipase C as well as an influx of calcium ions. So the activated platelets will then exocytose the contents of the dense granules as well as alpha granules. So ADP, serotonin and calcium will be released from the dense granules, and also growth factors, von Willebrand factor and clotting factors, mainly factor 5 as well as fibrinogen, will be released from the alpha granules, and the enzymes releases causes the production of thromboxane A2. And associated with the activation of platelets, there are certain morphological changes and also occur on the surface of the platelets. That is, the normal platelets, they will begin to swell. So the size will get increased. And you can also see that there occurs elongation of long filamentous pseudopodia, which is known as philopodia. It is again another feature of the activated platelets. So activated platelets will show some morphological changes, as well as they will begin to secrete the contents of dense granules as well as alpha granules outside. Next step is the aggregation of the platelets. The released ADP from these granules will act on another receptor in the platelet membrane. That is, the receptor is the ADP receptors. So the released ADP from the granules, they act on the ADP receptors in the platelet membrane, and they will produce aggregation or grouping or binding of the platelets with one another. And there are three types of platelet ADP receptors on the platelet in humans, that is P2Y1, Y2 as well as X1. And this aggregation, it is fostered by a platelet activating factor, which is secreted from the neutrophils as well as from the monocytes. So the activated platelets, the GP2B3A receptor, they undergo conformational change, and this GP2B3A receptor, it will bind to the fibrinogen which will present in the blood, and they form bridges between the platelets, helping in the grouping or binding of the platelets with one another, resulting in the formation of a temporary hemostatic plug, also known as platelet plug. It is about the properties of the platelets. Now we are moving on to the functions of the platelets. The first function is it got a main role in the primary hemostasis. That is, the platelet plug helps to stop the bleeding in the capillaries. So the temporary hemostatic plug or platelet plug formation is the main function of the platelets. Thereby, it got a major role in the primary hemostasis. The second function is it got a role in the vasoconstriction because of the substances secreted by the granules inside the platelets, particularly serotonin. It also got a role in the coagulation because of the secretion of the clotting factors, factor 5 as well as fibrinogen. Then it also got a role in the clot retraction because of the presence of the content, that is, contractile proteins are also present inside the platelets like thrombostatin, actin as well as myosin. And another content of the platelets is the platelet-derived growth factor, and that helps in the growth of our vascular endothelium. That is, helps in the proper repair of the vascular endothelium after injury, and also helps in the growth of the vascular smooth muscles as well as fibroblast. And it helps in the repair of the damaged blood vessels, and it also helps to maintain the health and integrity of the vascular endothelium. And another function is of platelets is it also got a phagocytic function. So, in short, this clinical scenario is of the thrombocytopenic purpura case, and one of the main feature of the thrombocytopenic purpura is easy bruisability and spontaneous bleeding into the skin, mucous membrane as well as internal tissue. And main defect here occurs because of the defect in the clot retraction as well as poor constriction of the ruptured vessels. So the third question of this essay was comment on the bleeding time as well as clotting time of this patient. So in this case, only the platelet count is decreased. So the bleeding time will be prolonged. But all other clotting factors are actually normal. So all other tests, that is, you will get it as normal. That is normal clotting time, normal prothrombin time, and normal activated partial thromboplastin time. So only the prolonged bleeding time is the feature of this thrombocytopenic purpura, whereas you will get normal CT, PT as well as APTT in this patient. That's about the idiopathic thrombocytopenic purpura as well as the platelets. Thank you.